All right, party people, we are back at it with another one. Let's get it. So we have a 45-year-old female with a 6-month history of fatigue and pruritus, and her blood pressure is 140/90. That is hypertension. Now, as far as labs, her ALP is 400, her total bilirubin is 3.3, and amylase is normal. Now you have to know that for ALP, normal is 50 to 150. Bilirubin normal is around 1, and amylase is usually between 30 to 120. Now you do have to memorize these for your exam. It'll save you time in terms of looking at the values. Now in terms of her physical, there is no abdominal pain. She has an enlarged gallbladder on palpation, as well as jaundice. She smells like cigarettes. Now, her not having abdominal pain pushes us away from stones. Now when I say stones, I'm referencing choledocholitis or cholelithiasis. Now, as far as the rest of the exam, the enlarged gallbladder, jaundice, and no fever, as well as the smell of cigarettes, plus the elevated ALP and bilirubin, we're going to be thinking about post-hepatic obstruction. Now, the fact that the pancreatic enzymes are not elevated, this is also noteworthy. This points us towards pancreatic cancer at the head of the pancreas. This would be compressing the common bile duct. Now, as far as the classic Courvoisier sign, here we have painless, palpable gallbladder in a jaundice patient that's afebrile. Now for this patient, if I was to ask you what is the best next step for a 45-year-old female with a 6-month history of fatigue and pruritus with hypertension, elevated ALP, elevated bilirubin, no pain on physical, as well as an enlarged gallbladder with jaundice, and she smells like cigarettes, the next best step would be CT of the abdomen. All right, let's get into why that's the correct answer and why other options would be incorrect. For pancreatic cancer, the next best step is CT abdomen scan with contrast. This is your licensing exam answer. As far as cholelithiasis, this is stones in the gallbladder. Here we'll be doing an ultrasound, and usually the patient is not jaundiced. For choledocholitis, this is stones in the biliary tree. Here the choice is ERCP, not ultrasound on your licensing exams. Gallstone pancreatitis, here you'd have amylase or lipase elevated. These stones block the pancreatic duct, thus resulting in increased enzymes. As far as cholangiocarcinoma, this is bile duct cancer. If in our patient the CT showed no pancreatic abnormality, we would be then thinking of cholangiocarcinoma. The next best step would be ERCP. As far as primary biliary cirrhosis, here they would give you a middle-aged woman with diffuse pruritus, high cholesterol, autoimmune background. So for example, she might have something to do with autoimmune disease, or maybe a family member, she might have a brother that had something. This is how the USMLE or licensing exam tells you that there's something that they want you to recognize as far as autoimmune reactivity. So here, in this particular case, for primary biliary cirrhosis, you'd be checking the anti-mitochondrial antibodies, and then you'd follow up and confirm with a liver biopsy. Now, other fun facts that are relevant for your licensing exam. You want to be thinking about endoscopic ultrasound. This is rarely tested but can detect posterior pancreatic tumors, or it can also be used to drain fluid collections. As far as ERCP, this is also used for draining pancreatic pseudocysts. As far as a HEDA scan, this is cholecystography. This is used for suspected cholecystitis when ultrasound is equivocal. HEDA scan, or cholecystography, this is used for suspected cholecystitis when you can't tell via ultrasound. This is positive when the gallbladder fails to fill with the tracer that's injected. All right, let's spin the block. If you have a patient with painless jaundice plus a palpable gallbladder, we're thinking pancreatic cancer, specifically head of pancreas. The next best step is CT abdomen with contrast. If you have a patient with amylase and lipase that are very high plus pain, we're thinking gallstone pancreatitis. If you have stones in the gallbladder, there's pain but no jaundice, next step is ultrasound. As far as stones in the biliary tree, this is jaundice with pain, we're thinking ERCP. If you have a normal CT in a smoker with obstructive jaundice, we're thinking cholangiocarcinoma. So this is the cleanest way that I can present it. That's going to be it for this one. If you like the video, comment, share, subscribe, and check out my Substack that's linked below. Go crush it.